balance. That is what Ayurveda also says.
Okay.
Sarva dharmeshu madhyamam. That is the word used in Ayurveda. Everything they are talking about a moderate way of doing things.
Okay.
And there is another beautiful shloka where Ayurveda describes Sukhartha sarva bhutanam mata sarva pravartaya sukham chana vina dharmat tasma dharma parobhavya. This is what the meaning is. Very simple, very beautiful. What they say that actually every living beings want sukha. Sukha means the comfort. Dharmata vina sukham nacha. If you dharma means the dutiest and the justified things you should do, then only you will get sukha. Sukhata vina dharmam nacha. No, tasma dharma parobhavet. Then so you become dutiful and kind to everybody. That dharma. And dharma, what is dharma? They very simply say that how do you want the world to behave? Because if somebody behaves you properly, you feel good.
Yes.
So the same behavior you try to give to others also. That is very simple, very beautiful. And then
lovely.
Yes. So so ethics also is there. And another important aspect that I would like to mention one point about Ayurveda. If you see that Ayurveda is the oldest organized medicine in the planet, because there are codified, documented literature. It is not a, because many times Ayurveda is referred as a herbal medicine, something like that. It is not simply herbal medicine. It is actually codified literatures are there. Charaka Samhita, Sushruta Samhita, Ashtanga Hridayam, Ashtanga Sangraham. These are all codified literature dated thousands of years back. In that, actually they are very meticulously describing about all these things.
Okay.
And I would rather like to put it in this way. For example, in the disease care area, they were mentioning about so many herbs and polyherbal combinations also. Now, a simple example I will tell you. Tinospora cordifolia is a botanical name. I am just mentioning this for others too. It is Gilai. We call it Gilai in Hindi.
Okay.
It is used in arthritis from time immemorial. Thousands of years Ayurveda is talking about Gilai. And modern scientific research using modern tools. Dr. Sharadini Dahanukar, who is no more now, she is a pharmacologist, head of Department of Pharmacology from Bombay Seth Medical College. She had done a lot of research using modern tools in Gilai. And it has come out to be immunomodulatory action and anti-inflammatory action. So the beauty is that how did they came to a conclusion that this medicine works in, which is an ideal drug of choice in arthritis, which is
thousands of years.
Thousands of years. So they were having their own methodology to analyze these things and do these things. And more than 90%, because now a lot of research activities are going on.
Right.
So when they pick up the drugs, as per mentioned in the text, and analyzing using modern tools, it gives almost 80-90% results are same. So this is a system where these kind of and judicious combination with other systems can help mankind to improve.
I now want to come to some other commercial aspect of this. You know, a lot of spas and beauty treatments.
Yes.
In fact, Ayurveda has been adopted by all those selling beauty.
Yes.
What is the match there?
I'm not against spas or something like that, but I would like to very humbly tell everybody who are governing this field, or who are in this field, that this has to be done with utmost care. See, the Panchakarma, I'm talking about the word Panchakarma comes in that. In chronic problems, because Ayurveda tells about, I told you about the disease care system, wellness treatment and illness treatment are different, because the spas and such people are mainly doing wellness treatment, because a person who is having simply stress or he is not having much physical problems, they are coming for a relaxation of massage or beauty care, something like that.
Okay.
Whereas we, especially Ayurveda Sala, the 108-year-old tradition, we have lot of chronic patients coming from all over India and actually more than 52 countries people are coming to Kottakal as well as in Delhi also. Chronic cases in the sense musculoskeletal problems, arthritic type of problems, skin problems, neurological complaints like Parkinson's, motor neuron diseases, then so many other things. But we are also not offering a cure. It is again to improve their quality of life. It helps a lot. We were discussing about the wellness treatment. Wellness treatment is something good, no doubt about that. But very specifically, especially in Panchakarma. Panchakarma is 5 purificatory therapies of the body. We have to do the Purva Karmas, that the body has to be prepared with certain measures, and then the Pradhana Karma, the purification is done. Then afterwards also the Paschat Karma also is done. This has to be done in this way. If it is not done in this way, it can wrongly, because it can give you so many problems also. Why I am worried about this? Because I would like to bring to the notice of everybody. Suppose a qualified person is not doing all these things. If he is not giving proper instructions to the person, because that may be a normal person, but later on he can develop problems.
Oh, I see.
So that is why I feel very sad about that, because after a Shirodhara and such things are to be done with meticulous care and concern also, and the flow of the liquid, what medicine we are using, we have to give proper guidance to the patient. Simply taking Shirodhara for 1 hour and afterwards going to a
normal life outside.
Normal life, or even lying in beach in salty water can cause problems. So I feel very sad about that, because after some time there can some article come in somewhere from Europe or in Lancet telling that people who are going and taking this relaxation treatment is developing some sort of problems.
Which will reflect poorly on the whole system.
It is actually negatively affect our system. So my only request is that everybody can do that, but qualified personnel who know about all these things should be there, and they should guide them properly. Don't do it as such. Anybody can do, anytime can do. That is actually very wrong. Yes.
Dr. Ramesh, time now for another break.
Yes.
Again, when we come back, we will discuss more about, of course, what research and all that is happening in the Ayurveda Sala.
Yes.
And also certain diseases like cancer and Ayurveda. What is the relationship? Are there cures? You've done immense research in this area.
Yes.
So we'll talk about all that and a lot more.